Hello, my name is Mona Shade. I'm going to present the topic that I really find interesting, which is the central or universal EMR. A little background here. According to the Institute of Medicine, the definition of EMR is a computer-based patient record that contains the patient information starting with the name, date of birth, the residency address, the encounter with the provider, including progress note, medical history, medication list, medical report, such as laboratory test, imaging test, and so on. And EMR was unanimously agreed on as a part of healthcare reform by the U.S. legislative, medical community, and general population. EMR was found to curb the overinflation of medical care, and there are multiple EMR software systems out there in the market with specific characteristics to meet the needs of different medical disciplinary and settings of medical practice, like, for example, inpatient versus outpatients. We do have a situation here or problem that we are facing in the U.S. healthcare system. Each medical institution, as we all know, has their own EMR. Even sometimes you would see one institution might have a multiple EMR, especially those huge institutions where they do have like a multiple disciplinary system. For example, if they do have like ophthalmology, orthopedic, ER, and then if there is like a multiple trauma center. So all these different specialties, they do have specific needs for a different type of EMR. And then different EMR software, keep in mind that they do not communicate, which is a huge problem, which created a problem both to the patient when it comes to the safety, as well as to the payer, as well as to the general society. EMR use increase the risk of breach into the patient information. And EMR technically has not curbed the medical cost inflation, which was in the first place advocated to decrease the inflation or the cost of or the spending in healthcare. And the spending continued to rise over the course of the years. So we do have a problem here, which is the lack of communication. And as a result of that, there is a complications. So lack of communication in the EMR system pose patient safety risk. Especially like, for example, if there is data that's needed or missing, especially during the time of decision-making in emergency situation. And the absence of the proper flow of information from one institution to another or from one provider to another. And repetition of unnecessary medical tests due to the lack of communication, which increased the spending in the healthcare. And I've seen this personally. I have seen a patient one day who told me in one day they had the same test done twice for two different providers, which is an increase of a cost to the patient as well as to the society in general. Other complication is delaying in treatment. For example, if a patient is in a different city or in a different institution that do not have their medical problem, and the patient needed an emergency care, then the care will be delayed until the test results are available. And then there is increased risk of preventable complication. For example, if the patient was hospitalized and then discharged, but the EMR are not communicating, and the hospital do not communicate with the, for example, primary care provider regarding the patient status, and the patient didn't communicate with the primary care provider, then the patient care would be interrupted here, which could result in a complication that can lead into hospital readmission. And all these scenarios can be preventable if there is a good communication between two institutions, different providers as well. And there is an increased rate of malpractice cases. Although at the beginning, everyone thought that EMR would decrease the malpractice, but it hasn't. And as a result of increasing healthcare spending, the CMS continue to try to save the budget by cutting the reimbursement to institution to the provider. And as a result of that, several small practices and small institutions, especially in the rural area, has been closed, and the patient or the population, I would say, are paying the price. Here is a diagram I created. I found this information on CDC, and it's showing us a trend in healthcare spending per GDP from 1960s up to 2019. And we can see here the trend is to continue to rise. And here is another diagram showing us the claim or malpractice cases. It has not changed, even it has been increasing from 2013, from 2012, 13, and then we can see the jump or the rise into 2015, 16, as well as 18. And here I'm showing the comparison between the US healthcare spending and other countries in developing world. And some of these countries had a universal EMR. Especially Germany has been implementing universal EMR, and we can see here the difference in spending between the US and the other countries. So how to solve the problem? Solving the problem of lack of communication between the different EMR is establishing a universal EMR. Universal EMR technically was the idea that was proposed when the EMR was proposing earlier in 2000s or late 1990s, but the federal government didn't approve it as it was like afraid to go into high spending on establishing the EMR for all healthcare system in the US as well as the maintenance. But now we know that the EMR has cost even more money with the repetition of unnecessary tests, as well as the patient safety risk. So one of the solution I propose is establishing a central or universal EMR is required to resolve the lack of communication between the different EMR. And it should be the federal government's duty to establish and maintain the central EMR. With the central EMR, every clinician, patient, or any other healthcare provider who needs to get an access to the patient medical record, they can do that at any time in any situation. With central EMR, there is no delay in patient care as records can be accessed with patient ID in real time. And patients in countries where the EMR or central EMR are already implemented has a better satisfaction and trust in their healthcare system when compared to countries like the US, where the central EMR is not implemented. And here is some of the advantages of the central EMR. With the central EMR, there is an avoid of having unnecessary tests done, which will save the spending, and the CMS, especially the Central of Medicare and the Medicaid, would save tons of money on the budget, which would stop the cut on the reimbursement. This would help reopening of facilities and medical practices, especially in the rural area. And also one of the negative consequences of the multiple EMR was the delay in the workflow, as well as clinician burnout. So with the central EMR, all these negative impacts will be resolved. So thank you. That's all I have for today. If you do have any questions, please feel free to contact me. Thank you. Have a good day.